In our morning rounds, new recommendations for the treatment of low back pain. A quarter of Americans have had back pain at least once in the past 3 months. A new review finds the best therapy may not include a pill. The American College of Physicians is now telling doctors prescription medication should be considered a last resort in most cases. Our Dr. Tara Narula joins us at the table to discuss. So before we get into what you think should be the best thing to do, back pain, I hear, is the worst pain that you can have because it affects everything that you do.
It does, and that's what I really want to focus on. Your back is the structural foundation. When your back has a problem, it affects every single everyday activity you do. It can be crippling for people and cause distress not just physically but mentally. And when you see someone in back pain, you talk to them, you hear it in their voice, you see it on their face. It costs our country $100 billion a year to treat back pain, and 2/3 of that is from lost wages and productivity. So in the past, a lot of the treatment has been focused on drugs and expensive drugs and harmful drugs. And now what this is doing is really taking drugs out of the picture and saying what was alternative therapy now should become mainstream therapy.
Sounds like a more holistic approach.
Yes.
So what do these guidelines suggest?
So these guidelines break back pain down into acute and subacute, which is essentially less than 12 weeks versus chronic. For the acute and subacute, the recommendation is non-drug. So that means things like heat, massage, acupuncture, spinal manipulation. If those fail, then the second line for acute or subacute is NSAIDs, things like ibuprofen, Aleve, or skeletal muscle relaxants. If you have chronic back pain, so back pain lasting more than 12 weeks, again, recommendation things like exercise, physical therapy, mindfulness, Tai Chi, yoga. If that fails, second line is NSAID therapy or medications like Tramadol or Cymbalta.
The guidelines also tell us what doesn't work at all. What was the most surprising in there to you?
Tylenol. So a lot of people have used Tylenol, and that was recommended in the previous guidelines in 2007, and now we found that it really doesn't work as effectively for pain in acute back pain. Also, things that were found to be ineffective or less effective, steroids, so oral steroid treatment, electrical stimulation, and ultrasound.
And opioids is a last resort.
Yep.
Opioids, last resort. If everything else fails, make sure that the benefits outweigh the risks. Make sure that you have a realistic discussion with your doctor.
I've had that back pain. There is nothing worse.
Nothing
mentally
worse.
and physically. All right, Dr. Tara Narula, thanks.